Hi, everybody. Welcome today to another episode of BEqualise podcast. Hi, Dr. Enrico Armato with us today. Hi, good morning.
Hello, nice to meet you, Viviana. It's a great pleasure spend some time with you, and for me, it is a great honor. Thank you so much for giving me this opportunity. Really.
Thank you, thank you. So, as you know, within the BEqualise group, we start adding more
Eh?
specialists, and today we have our guest, ENT Dr. Enrico Armato. I am really delighted to have him joining BEqualise. So, just for the BEqualise patients and community, we're going to dive into the background of Dr. Enrico, where is he based, what work has been doing, and then we will touch point some of the things that might be relevant for the patients. So, first of all, welcome again. So, Dr. Enrico, would you tell us, and especially for our patients following us, a little bit more about you, your background, and what you've been doing in the past years, and especially the exciting journey that you took with your recent PhD. So, please tell us a bit more about you for the people that don't know you already.
Thank you so much. I am a ENT consultant since 1987, so you can realize how much time I spent with hair, nose, throat, and after some experience in the surgery, I decided to to be an expert of the vestibular system. The reason is very simple because in my country there are not so many. There is not many people attending with this topic, and it is very passionating. And so I decided, why not? Why not to be an expert in the vestibular field, neuro-otological field, and dizziness and vertigo, all the situation that affect many people. So I decided to create my personal background. I
Mhm.
visit many other colleagues, and I learned very much from them, especially Enrico Ulmer in France, Marseille. He has been my master, and I learned from him a lot, really. And
Yeah.
then I purpose to be a reference in the North Italy, and I started to assess my patient in a different way by instrumental assessment with the video nystagmography, with a head impulse test. I wrote some books on the topic, and for me, it's very important to help people to give a consistent aid to them to solve the situation, because
Yes.
vertigo is a
Yeah.
very bad situation.
Tricky. Yeah, maybe with these regards, we can just for the patients touch base because a lot of them, when they write to us, they ask us, yeah, but when I go to an ENT, they don't understand what I have. So maybe
Oh,
this is a good opportunity is to explain that ENT is a big specialization, ear, nose, and throat, and you need
yes.
to find a vestibologist, somebody that understands the vestibular system. That's why what you did is more like to become really an expert in neurootology. This is another thing that it's very important maybe to just explain that there is not just the balance, so the vestibular and the peripheral system, but there is the neurological component.
Oh, yes.
And
Yes,
that's
sure.
where your specialization is a little bit different than just being an ENT, let's say. Tell us a bit more maybe about your PhD as well, just so that people will, 'cause it's fantastic that you just
Yes,
decided.
because many colleagues starts and ends their PhD at the beginning of their career, and for me it is the contrary. I started to work in the public health national system very early, and now I have more time, and I decided, because I closed this position, and I decided to do it, and it was very challenging. My university is the Lorraine University in France. The city is Nancy, and my PhD director is Professor Philippe Perrin in Nancy. And he stated that the title of my PhD thesis, determinants of recovery for compensation or healing in patients affected by vestibular neuritis. Vestibular neuritis is a common situation, a common disease. Many people are affected, and sometimes they can evolve in a very favorable way, so they can recover all exam and quality of life. But sometimes don't forget that two other possibilities are present, especially patient that recover completely by the instrumental point of view, but the quality of life is very bad. The DHI, the dizziness handicap inventory, that this is the common way to evaluate the quality of life of our patient. They can have a very high total score in presence of a good instrumental examination. But there is also the contrary, patient that don't recover in any way, but the quality of life is very good, because the
So
yes, the total score is very low as a normal people. So
yeah.
many possibilities.
Um, I have a question. So just for our audience, because we don't
Yes,
have only
sure.
doctors following us, but also patients. So what is, first of all, let's maybe explain 1 minute vestibular neurotitis, vestibular neuritis, inflammation of the eighth cranial nerve that
Yes.
can come from many different reasons, right?
Viral, vascular, but no one no one knows it really.
Nobody really knows it. Yeah. Very
Yes,
common, true, very common even among any age and any
yes.
gender, right?
Yes. And you have for many days a strong symptoms, a very strong vertigo with nausea, with
Vomiting.
vomit, with all all around, and slowly you can recovery, and you can restart to move. It is
Mhm.
important to restart moving very soon, as
Yeah.
soon the disease start its course,
It's
because
okay.
if you delay this activity, motor activity, your compensation could be lower, at a lower degree of efficiency.
Okay. So let's
So
stick on let's because this is very interesting. Actually, there are a lot of people that don't they're not 100% aware
yeah,
of this. So, and I've seen many unfortunately patients that when they have a vestibular neuritis, they go to the emergency, because literally you have this very, very strong vertigo. They can't even walk, constant vomiting. They can't keep still.
True.
It's usually affecting unilateral one side of
Yes,
the ear.
really.
But when they go to the emergency, apart from being given the vestibular suppressant, they
Oh
get
no,
told
a
sometime.
very, very
Yeah,
short period because vestibular
yes,
suppressants are not friends of compensation. So if you
exactly.
if the time go gone, you can not be in the on the right way. So
Exactly. This is very important because maybe what I've seen is that so many vestibular neuritis patients, they get vestibular suppressant, which are basically for in
and
terms of
stay
the
in
patient.
bed, don't move, keep
Exactly.
your
They get
eyes
told.
closed, don't walk.
Exactly. This is
It's
exactly what
terrible.
the point I want to make, because you are an
Yeah.
expert in this, doing a PhD in vestibular neuritis. Most patients, so first of all, they get given vestibular suppressant, which, to explain the patients, is basically something that will completely inhibit the input
Yes.
of your inner ear, so that
Yes.
you don't have the vertigo and the nausea anymore. But
Yes.
what happened?
For
Yeah,
24 hours, 48 at maximum, no more.
e- exactly.
And
So
many,
you should
many
not
times
abuse.
also also anxiolytic are
Yeah,
used, and
yes,
diazepam, and but they works in they are vestibular suppressant. So for a short time, good, but please don't use for a long time because your health will
will
not be
not.
the same.
Okay, so this is important. So if you are being given vestibular suppressant or any drug to inhibit your input for too long,
No.
that will affect your compensation and your recovery journey, in simple terms, for the
Yes.
patients. Okay. And so you've noticed, because what I've noticed is that exactly the guidelines that they are given are what you mentioned before. Don't move, stay in
Yeah.
darkness,
Terrible.
which are completely the opposite of what you're
No.
saying.
Best friend of compensation is movement. Start
Nice.
moving in a safe way, but move. Open your eyes, read, move your head, walk, and so it is likely you have many more results with movement than when you stay uh, at rest.
Without moving. Okay, fantastic. So the number one, once again, we go back to BEqualise
Always
holistic
for
approach,
for
moving.
for any disease of the vestibular system,
Yeah, yeah,
not
sure.
for
Moving.
vestibular neuritis,
That's
for
exactly what we promote.
any,
We
any.
promote always to do fitness, to move, to engage the ocular
Oh,
motor
sure,
movement, to engage the proprioceptor, to keep moving. Okay, that's fantastic. So,
really.
your PhD, you've been doing research on vestibular neuritis and their recovery. And
Yes.
my question is, did you see that these patients that had a peripheral problem like vestibular neuritis develop visually induced dizziness?
Oh, yes, it is. It could happen.
Mhm.
Fortunately, is not very common, but you can see people who complain very, very strong malaise when they are in a supermarket, when they are driving, in all situation where there are many objects that are moving. So they because they really their steadiness on the visual input, vestibular is a little bit out of order. So visual become the preeminent,
Picture.
become the more important, and but it has a cost, and
Yeah.
visual
Visual
induced
industry, yes. So this is something
can
maybe
happen.
we can exactly. So when, let's say that, just for everybody, because again we have patients that are not maybe expert in the vestibular, so the balance
Yeah.
system works from an integration from the eyes, the ears, and your proprioceptors, so all over your body. And what happens is that when you have a problem with one part of your, for example, in this case, one nerve, the eighth
One
cranial nerve,
vestibular,
right? They
yeah.
become visually dependent, and that's why they use their eyes to balance themselves, and they don't rely on the proprioceptor. So once again, moving can switch that mechanism back, right?
Vestibular is less efficient, less reliable, so the patient tend to rely on visual.
Mm-hmm.
But when the visual field is filled with many moving objects,
Inputs, yeah.
yes, it could be not the best
Challenging for
for
them,
our
yeah.
patient. Yes.
Okay, fantastic. And another questions for you. Do you have any ideas on also, according to whatever you observed throughout the years, what will be an help? What will be the best way, apart from an early movement, that can really help the patients to recover and compensate better? What do you think it's a key aspect, also on the psychological component, or I
Yeah,
don't know?
right. You have said the right word, Dr. Vivi, because there are strong relationships between our cognition, our emotions, and vestibular apparatus. So you must take care also of the emotional component because vertigo could be a very bad experience, and in some people it can be for some people it can be very difficult to manage such an emotional damage. So, in my opinion, is very important to give some kind of reassurance to our patient because it is important that they know the future can be always good.
Yeah, because
Because
it can
sometimes
be.
some people say, "Oh, I will be so
Sure.
dizzy for forever," and so is a negative loop, and
Yeah,
so
self-fulfilling negative prophecy, kind of like,
yeah,
yeah. And also
yeah,
maybe because vertigo can be a trauma
yes,
for them.
it
It's
is,
not
it is,
trauma
it
because
is
it's really okay.
really, really great.
What do you
All
suggest
in
patients?
in a strong way in a
Mhm.
patient that would to control everything in their life because vertigo comes when when it decided, not when we want.
We
So
want.
we are not able to control everything. We must
Okay.
accept that many things are out of our control, but we can do the best anyway.
Okay. So do you suggest your patients to work also on their mental component? Yeah.
Yes, sure.
Okay.
I it
Nice.
is I want every time to reassure them. Don't
Mhm.
worry, you can not recover your functional exam, but you anyway you could develop some substitution mechanism that can give your near normal life.
Okay.
This
Yeah,
is
I think
important.
reassuring the patients is very important because they need to know that there is a way out and that it's possible to get back to normal.
If you say to the patient, your vestibular apparatus is dead, no more, it's
Won't
but
work.
I know someone that
Does
did,
that.
yes, yes,
Yeah, yeah,
yes.
yeah. No, and also this is why we're doing this kind of podcast, also to educate them on the fact that despite the disease, there is, for example, what we mentioned before, the integration, the movement, the mindset, the things that you can do to improve yourself. Now, switching a bit more on a different topic, me and you, we've been working together for years. I've been recommending patients from Italy that suffer from mal-de-débarquement syndrome.
Oh, you are
So
very a great expert.
yes, and the only thing I've done during my PhD, MDDS. But I wanted to maybe with you from your clinical experience and all the patients that you see, because you see so many patients now with MDDS. Um, this is more for everybody that is following us, from doctor to patients. You, when you perform the exam on MDDS patients,
Yeah,
I want you to explain the fact that most of the time everything is normal, but they
absolutely.
still have the symptoms.
No functional derangement. It's because the plane is different. Is not in the periphery. It is in the higher level for sure. The problem where visual, vestibular, and proprioception are linked together. Um,
Yes,
Vestibular nuclei and upper. And
upper, yeah.
so the therapy, no, you are very expert in this field, is not always easy, but can be done.
Mhm.
Visual
Visual
stimulation,
stimuli, yeah.
opticokinetic visual stimulation, and in a second step, other more particular therapy. I
Mhm.
know. Oh, the
Uh, like therapies also that are
yeah,
similar to vestibular migraine, right?
yeah,
Sometimes they work. But my question is, so because this is important, another like tips for everybody. If you have MDDS and you feel unstable, but you go to an ENT and he
yes,
says everything is normal, that's okay. That's how it should be, right?
yes.
Everything should be normal
No,
because
no, many,
that,
the
mm,
problem, Vivi, is many ENT are surgeon and not so skilled in the vestibular field. So when all is okay, they dismiss the patient, say hello, bye bye, you can go. Is not so simple the question because you must know that MDDS exists because not all ENT consultant
they
have
know.
a clear idea of MDDS. It's true. It's true. So first of all, you must know the disease, and you have to explain in a very detailed way to the patients because they must know what is, and then you can go with them towards some therapeutic goals.
Mhm.
Yes.
Okay. This is important, especially to hear it from you that you've been seeing a lot of clinical patients. So, and it's important that they find somebody that knows the disease. Now, just briefly before we perhaps conclude, if somebody wants to have a consultation with you, where
Yeah.
are you based? Can they have consultation online? I think online also works very well if they can do the test that you need somewhere
Yeah.
else, but just give a few informations about yourself.
I am based in Italy. I am based near Venice, near Venezia, and here I there is my office, and I visit all the day. But anyway, by video call, by we can in any way to exchange very important information about this situation. And the patient many times has already done many exams. It's important that I evaluate them to know really if is all is okay, all has been performed in the right way, and then we can discuss with the patient what the best solution.
Okay, fantastic. So this is important if you are a BEqualise patient in Europe and you speak French, Italian,
Yes.
or also English. But it's
I,
important
I
as
had I had to learn French.
yeah, basically you speak perfect French and you want to consult with Dr. Enrico, please reach out to BEqualise and we can just redirect you to him.
Yes,
And the way we work, as he mentioned, is very well aware of the holistic approach. I think this is the key for the patients to understand that it's not just one of the things they always complain is like, yeah, I go to a doctor, then I'm going to get a medication, and then what? Actually, it's not like this simple. You get a medication, maybe, but you also get treatment, like in terms of many more things, right? So you are also a promoter of holistic approach, like to work with the movement, rehabilitation.
necessary. Mm, a level of anxiety it must be reduced.
Yes.
What you eat every day in your life is very, very important. What which kind of sport activity you perform, and so on, because all can give a contribution
Okay, fantastic.
to
Okay, so
for wellness.
for wellness, yeah, because the key is to really make clear to everybody that vestibular is so intrinsic and doesn't it's not just one organ, it's
No, no,
everything.
no.
So you have to look at
Many
everything.
times I like to say that vestibular system is the interface between ourself and all is not ourself. All is all around of us.
Us.
So is a very, very powerful interface.
Yeah,
And
it's the key.
yes, sure.
Yeah, I
All
agree.
pass through it.
Yeah, it's the primary system to make us
No,
understand where we stand in
yeah.
space. It's
The
true.
relation with the space and time.
Very interesting. Thank you so much, Dr. Enrico, for your time. I hope
No,
we will
pleasure.
be reached. Yeah, it's always a pleasure. I hope that more people will know more about you and your practice so that we can get people that understand really deeply the vestibular system. And we see both that there are a lot of patients that get mismanaged because, again, it's a niche field and you need to find the people that understand it.
For
Okay,
sure.
I wish you the best with the finalization of your PhD.
Thank you so
And
much.
next time we might talk more about your findings. Yeah, and thank you again for joining us at BEqualise.
Also for BEqualise, all the best.
Thank you
Really,
so
you
much.
worth it.
Thank you. Okay, thank you so much. Bye bye.
Bye,
Thank you.
bye. Have a
Bye.
nice